So I'm James Buckley. I'm the head of workforce health and wellbeing at UHDB, so University Hospitals of Derby and Burton NHS Foundation Trust. Bit of a mouthful, but essentially my role falls into two parts. The first one is looking after the welfare of the 16,000 colleagues and volunteers that we have primarily at UHDB. And then I also take the principal wellbeing lead across Joined Up Care Derbyshire. Yeah, well, I guess principally the problem we were trying to solve is the well documented healthcare issues that exist off the back of the global pandemic. So, the impact of the global pandemic on the health and social care workforce has been fairly well documented, and none more so than at UHDB, where we're one of the largest acute trusts in the Midlands. So really the programme is about how do we bring together a range of services and support-based services that can support our colleagues at a time when they're most in need of it. More broadly than that, the sector across kind of Derbyshire was about bringing together more of an equitable service solution. So how could we raise the bar on what was available across a range of different organisations to ensure that we had a more consistent model of support that was evidence-based and was impactive in its nature? So I guess first and foremost, we only look to measure what we intended on using, and that would have a direct impact on the services that we had in place. So primarily for either benchmarking purposes that had a clinical significance to the programs that we were delivering, or were appropriate for our direction of travel in terms of information gathering. So we used a range of sort of different metrics. We looked at our colleagues as customers essentially. So NPS question sets sat across all of the various elements of the program delivery. And then we also looked at a range of various physiological tests through to mental health and wellbeing scales as well. So namely, we use things like the Short Warwick Edinburgh mental health and wellbeing scales. We use the ONS question sets that enable us to benchmark across some of the more national metrics used in such as the active lives surveys, for example. And then we use more localized data as well in terms of engagement data and user information from the colleagues that were engaging in those programs. Yeah, so the impact of integrating data in our on our day-to-day processes has been really transformative for the organisation. Overall, we've seen over 350% growth in engagement across all of our services within the last 12 months. And we know that over 75% of colleagues have engaged in at least one of our supportive and preventative programmes. It's also enabled us to create a much broader evidence base to develop the service. So what was historically one wellbeing lead within the whole organisation has now become a team of 13 people driving this forward. From an NPS point of view, so from a net promoter score perspective, from a customer satisfaction perspective, we've got over 90, a score of over 90 across the overall sort of program offer, where a score of around 53 is typically seen as being a good benchmarking score within our particular sector, where the higher the score, the greater the level of customer satisfaction. And we've also embedded some of that data and some of those question sets within our wider health needs analysis as well. So our health needs analysis across not just the organisation at UHDB, but the wider system as well. So what we'll be able to do going forward is not just look program impact, but how does that program impact compared to the general population of colleagues? So if we have a certain score for mental health and wellbeing within a particular program, in comparison to the general population, we know that's a program that we'd be looking to invest further in, and again we can evidence the impact in that area. I think it'd be fair to say that pre-pandemic engagement in supportive services was a lot lower than what we see now. We've certainly been able to use the impact of the global pandemic to further evidence the need for investment in this area, and data has really enabled us to underpin that. It may be, that some of the assessment scores and the data metrics that we have in place would have scored differently pre-pandemic to what they're scoring now. I think it's certainly shone a light on the need for more wellbeing interventions, but equally, the need for investment in this space still comes with the need to be able to evidence the impact and articulate exactly what the areas are that delivering results, I guess, to support colleague wellbeing.